Health Hour with Black GPs and senior consultants giving Black health advice, improving Black health equality. CAHN Health Hour.
Good morning, everybody. Welcome to our regular Saturday CAHN Health Hour. My name is Ngozi Ediosage. I'm a paediatrician. I'm also the medical lead for CAHN. I work in Manchester. So a few weeks ago, we asked you all to put in the chat what sorts of things you'd like us to talk about. And one of those conditions was lupus, because we know it affects Black women. It has a preponderance towards Black women. And today we're delighted to invite an expert who has particular expertise on lupus and fibromyalgia. And he's going to spend the next half an hour talking to us about it. There'll be an opportunity for questions as usual. And we also are really, really pleased that we've got somebody who's going to talk about their own lived experience, because that helps us to identify what it's like to live with this condition. So we have an expert doctor and we have an expert patient. So please keep your questions coming in the chat and we will address them to both our experts. So thanks for joining us. So without further ado, I'm going to hand over to Dr. Kenny Sunmboye. Thank you, Kenny, for joining us. You've been before.
Yes.
Thanks for coming back.
Thank you, Ngozi. It's always a pleasure to be back. I'm really pleased and excited about the format you've chosen today to have a healthcare professional addressing it from my point of view and a patient actually living with the disease. That's really a very wonderful format you've adopted. Thanks for having me back, CAHN. You're doing an exceptional job. I can't overstate the kind of amazing work you're doing. So without further ado, let's get stuck in. So just give me 2 ticks. Yes, so as with every session that we have to talk about, we have to outline. So I think it's echoing a bit. You can put on your for me, please. That will help. Okay, so the outline for today's talk will be to talk about lupus, what it is, so that you're aware of the disease and how it affects you as the individual if you have the disease. We'll talk about how it's diagnosed, how it's treated, and what patients need to know. Then the second part of the talk will be spent talking about fibromyalgia, how it's also diagnosed, how it's treated, and what patients need to know as well. So a bit of what systemic lupus erythematosus is. It's obviously called lupus for short, or SLE, as the case may be. But for the duration of this talk, I will be calling it lupus because I think it makes it easier to keep everything the same and consistent. Now, I like a bit of history, especially medical history. It's always nice to know where the roots have come from as regards disease. So the term lupus was coined in the mid-1800s by Dr. CAHN after he found that the bite from a wolf tended to cause a very scarring, angry type of rash. Now, some people have argued that the facial pattern on the face of a wolf also mimic the rash that people get with lupus. It wasn't until the 1800s, late 1800s, where Sir William Osler actually discovered that lupus is a disease in its own entirety. It's a disease on its own. And he coined the term systemic lupus erythematosus. Now, the interesting fact about William Osler is that he's actually Canadian, but he's quite prominent in UK medical history, which is a bit of interesting trivia for anyone interested in medical trivia. So what is lupus? Essentially, lupus is what we describe as an autoimmune rheumatic disease. What that means is your body is sort of causing the attack on you. In lupus, what tends to happen is some proteins that the individual produces, the body picks up those proteins or antibodies as foreign and then starts to attack the individual, which is essentially what happens in lupus. Now, the attack can be in various organs. It can be in the kidneys. It can be in the skin. and it can be in the lung as well, although lung disease and lupus rarely ever tends to be quite serious, but it can be quite significant in that it can affect the individual's quality of life and their well-being. Now, with this attack that happens from the immune system, there's a lot of inflammation, there's a lot of swelling, and unfortunately, consequently, there's disease being established and then damage to tissue, which is what causes the problem with lupus. Now, what causes it? Before I talk about what causes it, just to be aware that lupus is a chronic condition. Now, what do I mean by chronic condition? Chronic condition means that lupus would have grumbled on for many, many weeks, many months, sometimes years, before you then have the diagnosis fully established. Although there are some forms of lupus that can be diagnosed in a few days, but most times the pattern we tend to hear is that the patient would have had symptoms for many weeks, many months, sometimes years, before they're finally diagnosed either by a rheumatologist or by a renal physician. Now, when it comes to the actual cause of lupus, the cause is actually unknown, but we know that genetics and environment plays a huge part. So what do I mean by genetics playing a big part? If a mother or father has lupus, there's a big chance that their children will have lupus. So if I put that in context for you, the chances of a daughter having lupus is 8 times compared to the general population. 8. That's incredibly significant. And the environment also plays a part, particularly sunlight. For those that might be interested in all things environmental, ultraviolet light is divided into 2 parts. We have UVA, which is implicated in aging, and UVB, which is the bad portion of ultraviolet light. So UVB, which is the part of ultraviolet light that tends to trigger lupus, damages the skin, damages the cells in the skin, and those cells that are damaged, the body picks it up as foreign and then causes lupus. Obviously, it doesn't happen like this in all individuals. It just happens in those that have the genetic template to having lupus. But there are other triggers that are known to causing lupus. Stress, and this can be emotional stress, work stress, life stress, infection. Again, there have been cases still coming in scientific data of people that have had very severe infection, even COVID-19 infection, that have gone on to have lupus. Remember, it's important to bear in mind that these individuals are already prone to disease, and disease has occurred because they're already prone to it. Now, drugs can cause lupus. It's not the common kinds of drugs that are used in day-to-day life. They tend to be specialist drugs to treat certain conditions. Social drugs can trigger lupus in people that have the genetic predisposition or are prone to getting lupus. Smoking is a no-no, it can trigger lupus. And obviously for people that have lupus, smoking can trigger flares, but we'll come to that. And certain hormones. When I mean hormones, it can be hormone supplementation, it can be HRT in women that have premature menopause. So these are very important things to be aware of. So who gets lupus? Anyone can get, anyone, any age, from a teenager to an elderly woman, but typically, for lupus are women of childbearing age. It's rare in men, but men can have lupus. I do have a few men on my service, but men tend to have very severe disease, a lot more severe than women do. But anyone can have lupus. But the typical age are women of childbearing age. So we don't see lupus in the elderly, and we tend not to diagnose it in the elderly, so that you're aware. Now, in terms of how common it is in UK population, UK prevalence figures would be about 28 out of 100,000. What that means is for every 100,000 people we see in the UK, 28 people will have lupus. And these are high prevalence figures. These are high numbers in general population. Certain races are typically affected in lupus. The most common race that is typically affected are Africans and Afro-Caribbeans. Hence the reason why this session has been set up magnanimously by CAHN, which is very poignant that they've done that. After Africans and Afro-Caribbeans, we have Hispanics, South Asians, and further down the ladder, we have Caucasians being affected. Now, the family history is very important, which I've touched on. If a father and mother has lupus, there's a chance that the daughter may have lupus. Not so much the son, but again, if men have it, like I said, it can be quite severe. Now, which organs are affected in lupus? You can see from this cartoon, no organ is spared. It's what we call a multisystemic disease, meaning all plethora of organs can be affected. The brain can be affected. People can have depression, seizures. They can have all sorts of problems. The skin, where there's damaging skin rash. The blood can be affected, that the blood cells can be low. The kidneys, understandably, can be affected. There's a famous musician, Selena Gomez. She had lupus and she's had a kidney transplant because her lupus was very bad and caused had to have a transplant. Then if anyone knows the African-American TV presenter, Nick Cannon also has lupus, and his lupus has taken its toll on his career. And I think he's not as prominent on TV at the moment, mainly because he's had issues with his lupus. The joints can be affected where there's inflammation. That just means swelling in the joints, it's pain in the joints. The spleen can be affected so that these patients are prone to infection. In very active states of lupus, you may actually behave as though you haven't got a spleen. So you're actually prone to certain types of infections because you have lupus. So I always recommend that my lupus patients should have all their vaccinations. They should have their flu vaccines, which is every year. They should have their pneumonia vaccines, which is every 5 years. I definitely recommend that for patients in my practice. There are various types of lupus we should be aware of. There's the systemic lupus type, which I mentioned earlier, where every organ is affected. There's the lupus confined to skin. We call that cutaneous lupus, and there are various types, but usually sunlight is implicated in the cause. There are drug-induced types. What that means is certain drugs can trigger lupus. The drugs, like I mentioned earlier, aren't the mainstream drugs that we use. Some of them are used to treat thyroid disease, that's overactive thyroid disease. And sadly, newborn children can have lupus. And that's basically because the mom passes on antibodies to the child at birth. And these children can have lupus, usually with very bad skin disease, but their disease tends to be quite mild eventually, which thankfully, that's something that we see. Now, what are the signs and symptoms of lupus you need to be aware of? But it is important to mention that just because you have lupus, do not expect anyone else to have the same lupus journey as you've had. No two cases of lupus are the same. Now, you can see from the slides that the symptoms are quite varied. You can have tiredness, you can have fever, and unfortunately, fever in the current context means that you need to get assessed for COVID. So unexplained fever can be an issue. There can be a rash, what's described as a butterfly rash. There's joint swelling that people may have, and there's also hair loss that people may struggle with. Now, I have to mention, when it comes to hair loss, most people panic about hair loss. Now, if a woman comes out of the shower, washes her hair, and dead hair that is usually unstable falls out, I'm not worried about that. That's not the kind of hair loss I'm talking about. The kind of hair loss I worry about is you waking up with locks of hair on your pillow. That's clearly abnormal. If you're sat down on a settee and you have hair shedding off without any difficulty, then you need to get yourself assessed. Now, I have to mention, that's not to say you have lupus. It just means you have significant hair loss. And oftentimes, significant hair loss can be a pointer to lupus. Not all the time. There are lots of causes why people have hair loss. So just because you have hair loss, don't panic. Tiredness is a big part of lupus. 90% of people, about half to 90%, struggle with tiredness, and it can be a big issue. But remember, any organ can be affected in lupus. So how do we diagnose it? It has to be diagnosed by a specialist. Now, the specialist can be a kidney doctor or a rheumatologist like myself. Most times, it's usually a rheumatologist. And we diagnose it by taking a proper history from yourselves. I always say to my students, because I teach at a medical school at Leicester, I say the key lies with the patient. The patient knows the disease better than anyone else. So the patient will tell us what they are struggling with. So, and once we've taken a history from you, we then do a blood test to try and determine how aggressive your symptoms are. Some people end up having a biopsy first, either of skin or of kidney. But remember that the most important thing is that your specialist has to take everything into account. It's not enough to have an abnormal blood test and say you have lupus. You need a lot more than that. People often commonly think just because I have an abnormal test, I need to have lupus. That's not entirely correct. You need blood tests to fall in place, and sometimes you need symptoms. Now, there's some people out there that have lupus type symptoms and their blood tests are normal. I always say that's reassuring. It's reassuring because it means that you are never going to have lupus that will limit your life. So that's reassuring. So bear that in mind and keep that in context. We've talked about the clinical symptoms that can occur. I think this cartoon just typifies that. I won't go to the ins and outs of that. How do we treat? Your specialist has to strike a balance between controlling your lupus activity and ensuring you don't get infection. People with lupus, they have two spikes that results into death in the course of their illness. First part is that they get overwhelming infection because of the treatments and they die. The second part, unfortunately, is that they have heart attacks, strokes, and mini strokes very early on, which is why if you're a lupus patient, if you smoke, that's a no-no. Absolutely, you shouldn't be smoking. That's something that you need to look into. I won't smoke myself. I haven't smoked in 21 years. It's worth giving up. If you have lupus and you smoke, smoking is an absolute no-no, worth looking at and getting rid of it. And obviously, if you do have lupus, you may have been exposed to steroids, which is good when used sensibly. There are drugs like cyclophosphamide, rituximab, but I won't bore you with the detail about the names of these drugs. The key thing is to speak to your specialist, and both of you will formulate a plan guided by your specialist to help you deal with the condition. And we also have some general lifestyle advice like sunscreen, making sure that you have sun protection factor 50 as a minimum. Slap it on religiously, even if you're a Black woman or a mixed ethnicity woman with dark skin, slap it on, SPF 50. You can't overestimate its benefits. So what do you need to know about lupus for anyone that might be wondering about the disease? Symptoms can come and go. Sometimes it can be mild, it can be severe, it can persist, then resolve. And it can come on quite suddenly after a period of resolution. Now, remember that a sudden onset activity of lupus, we term that a flare. And flares typically can be caused by anything: work stress, life stress, sunlight. Some people have gone on holiday to the Caribbean, to Morocco, to Egypt, and they've come back with a lupus flare. Infection, obviously, and not complying with your meds can cause a flare. So any flare symptom, if you see that this slide is something you've seen before, can present with the symptoms you had at the onset. So be on the lookout. If your lupus presented with this at the start with hair loss, then a flare might be hair loss. If you had joint pain and swelling, then your flare might be joint pain and swelling. So bear that in mind. Again, I've talked about it before. Not everyone's lupus is the same. People experience different issues, but the key thing about it is people with lupus are very prone to heart attacks, strokes, mini strokes. They can have diabetes because of treatment with steroids, and kidney disease can be a problem where some of them can end up having a kidney transplant, as in the case of Selena Gomez. There's no cure, but remember, do your part, take your tablets regularly, and there's research ongoing. So please do participate in research. We have an issue in the Black and Asian minority ethnic community. We don't tend to participate in research a lot. I am the regional research head for the East Midlands for musculoskeletal research, and I would encourage you that research is super important. Remember, today's drug was yesterday's research, so I can't oversell it or underemphasize it. Very important. So that's about lupus. We'll take questions at the end. So I'll talk about fibromyalgia. Now, incidentally, fibromyalgia and lupus are quite intertwined because a lot of patients with lupus can have fibromyalgia. So bear that in mind. So what is fibromyalgia, or FM, or FMS, as some specialists call it? Now, fibromyalgia is a term that was coined in the early 1900s. At the time, it was called fibrositis. I like a bit of history. But in the late 1900s, we got the term called fibromyalgia. The American College of Rheumatology created a nifty criteria to try and diagnose it. But essentially, for me, fibromyalgia is just a combination of three items: pain everywhere, sleep that doesn't refresh you, and poor sleep. Poor sleep, pain everywhere, and extreme tiredness. For me, that's an issue. And if you talk about the mechanisms behind it, we describe it as a central pain syndrome. You hurt everywhere, you're absolutely shattered, you're not sleeping too well. But this can be a larger part of a huge spectrum where people can have regional pain syndromes, you can struggle with depression, OCD, post-traumatic stress disorders, you can have a bit of bipolar in there, generalized anxiety, panic attacks, and chronic fatigue, even ME. Now, ME, which some of you may have heard about, ME people can start off with tiredness and then progress to fibromyalgia. This is very common. Fibromyalgia is extremely common. For every 100 people in the UK, 4 people have fibromyalgia. In fact, long COVID, which you've heard about on the news, is essentially fibromyalgia caused by the coronavirus. So let me repeat that. Long COVID is essentially fibromyalgia caused by the coronavirus. So very important that fibromyalgia is quite poignant. But fibromyalgia can overlap with lots of conditions. Some people with fibromyalgia can have chronic migraines, they can have irritable bowel syndrome, they can have an irritable bladder, they can have chronic pelvic pain, they can have tinnitus, ringing ears, they can be unstable on their feet, they can have problems with swallowing, they can have chest pain that is not related to the heart. We almost say that it mimics the, I'm not sure if anyone knows this proverb, the proverbial elephant that the 6 blind men tried to touch. An elephant was. One of the blind men touched the elephant's tail and said, "Oh, an elephant is a rope." A blind man touched the trunk and said, "Oh, an elephant must be a snake." Elephant and said, "Oh, the elephant is a wall." Another touched his ear and said, "Oh, the elephant is like a leaf." And one touched his tusk and said, "Oh, the elephant is like a spear." But what tends to happen is a rheumatologist such as myself, we take a very large perspective of the entire picture. We are the ones telling the story that it's an elephant after all. So it's important that whatever symptom you have, and you've seen lots of specialists, get your GP to refer you to a rheumatologist, particularly if you suspect this could be fibromyalgia. I've talked about how common it is, but majority of people have widespread pain. It does affect women a lot more than it does men. The ratio for women to men is 8-to-1, meaning that women are more likely to have fibromyalgia. It could be that women are reporting it more than men, and men are just being men. But again, the data does suggest that women can be affected. Genetics does play a part in fibromyalgia. If a mother or father has fibromyalgia, there's a likelihood that the child might have fibromyalgia. I don't necessarily think it's because there's a genetic link per se. I think it could be a factor of the nature versus nurture debate and the environment. But family members, we do know if a family member has fibromyalgia, there's a chance that other people may have. Now, fibromyalgia can come on as a result of stressful life events. And I can't overemphasize, these stressful life events can be trauma of disease, trauma of losing a spouse, trauma of losing your job, trauma of the coronavirus. That has really created a spike in the incidence of fibromyalgia I have diagnosed in my clinic. But it's a genuine diagnosis. We know that people with fibromyalgia, if we did a sort of optic scan on the brain, the thalamus, which is the organ that processes pain, tends to be very hot in people with fibromyalgia. So again, that's something you should be aware of. And this slide just shows you the areas where those areas of heat can occur in people with fibromyalgia. So it is a real diagnosis. How do we make the diagnosis? It's based on the history. So if you have a combination of pain everywhere, poor sleep, your sleep is not refreshing you, which is distinctly abnormal, and extreme tiredness, then it may well be that you have fibromyalgia. But there are other symptoms. There's forgetfulness, poor concentration, your bowels are all over the place, you have insensitivities to cold, sound, knocks and bumps. You might be a bit tearful, your ability to cope with pain is hampered or reduced. it's worthwhile considering this, and you should see your GP and speak to your GP about it. Now, blood tests you can't use blood tests to diagnose fibromyalgia. The blood tests are useful, though, just to tell us that it's nothing else. And the blood tests are useful to correct what I call the correctables. Most Black people, because of our skin and the melanin in skin, we don't make as much vitamin D. And sometimes when you have low vitamin D, you can ache. So if you have low vitamin D, make sure that's corrected. So the blood tests are useful to exclude other possibilities. Now, the treatment principles, I'm not going to belabor the point, but the treatment principles are basically to have a discussion with you, work on the mindset, try and deal with the functional issues you're having. If it's poor sleep, introduce modalities that will help with sleep. If it's a form of stress, if work stress is an issue, then that might be worth getting rid of. And I'll give you an example. There was a lady that was a school teacher, and she just hated her job as a school teacher. And she had longed to start her own business. And eventually she did that. She started her own business, got a dog so that she could walk the dog as a form of exercise. And that made her fibromyalgia loads better. There is no cure for fibromyalgia. So what you can hope to achieve is the ability to cope better. And there are celebrities with fibromyalgia. Lady Gaga has fibromyalgia, the musician. Morgan Freeman, the African-American actor, has fibromyalgia. And the former American president, JFK, had fibromyalgia. So it's incredibly, incredibly common. So exercise is important. Sometimes you might need a bit of clinical psychology, not because you're depressed, it's just to work on your mindset, your psyche, your ability to cope. But I recommend that I always say little as often as much as you can. And sometimes you may need medication, and it's okay to need medication. It's okay to have medication. But the key thing is embrace the condition, take your meds, exercise. But when it comes to fibromyalgia, what you put in is what you get out. You put nothing in, you get nothing out. You put something in, you get something out of it. And I always use Lady Gaga as the example. She's doing all sorts of things, she's singing, acting, and I think she has a movie that's out, it's House of Gucci. I haven't seen it as yet, but the key message is do what is best for you, but make sure little as often as much as you can. Start low, go slow, but make sure. Now, what do you? It's a real disease. People put funny ideas in your head. It's a disease. It's a genuine disease. We aim to reduce symptoms. We can't cure it, but we aim to increase your functionality. Ultimately, you as the patient with fibromyalgia, it's really down to you what you do with fibromyalgia. Your GP can help, give you advice, but ultimately, no one can tell you what your journey and your lived experiences are like. You need to take the bull by the horn, the proverbial bull by the horn, and try and get things going. The pattern can be up and down, meaning you have days where you're good, you're bad, you're good, you're stable, you're up and down, all over the place. But people do get better. Very important. And it's patient-led. You pace it, you direct it, you govern it, you set the pace. It's all about you in this condition. But remember, little as often as much as you can. And when it comes to fibromyalgia, the British moniker is no more apt as it is in fibromyalgia. It can't be overemphasized. Keep calm, carry on when it comes to fibromyalgia. Just a brief one about about vaccines, COVID vaccines, and you. Whether you have lupus or fibromyalgia, have your vaccinations. Very important. I cannot overemphasize vaccine health in people with disease. Remember, vaccinations are there to protect. Yes, there's a lot of controversy as regards vaccines, and in the States, there's almost vaccine hatred. But ultimately, this is scientific. It's not exoteric, it's not mystical, it's not witchcraft, it's science, okay? And follow the science and go with the science, okay? I have been vaccinated, and I do encourage my patients to have vaccines because they protect lupus patients and they protect anyone with a baseline medical condition. So thank you all for listening. I'm happy to take your questions, and I am on Twitter and Instagram. And, feel free to ask me anything, and I'm excited to hear about the patient that has lived with lupus. Thank you.
Thank you very much, Dr. Sunmboye. That was really, really interesting. I'm sure there'll be lots of questions. I'm going to invite Elizabeth Cameron, who has kindly agreed to come talk to us for about 5 minutes so that we can have a patient perspective on being affected with lupus. So is Elizabeth here?
She certainly is.
Can you spotlight the camera for her, please, CAHN team?
Okay.
Hi, Elizabeth. Thank you so much for joining us.
You're welcome.
It's really great to have two experts. I always think the patients are the experts as well, because they can give a real life view on what it is. So we do have lots of questions in the chat, so it'd be really nice for you to give us about 5 minutes on what it is about your experience of living with this condition.
So I'm just picking up Joan's point about cold hands. I suffer from Raynaud's with my lupus, so and that gives you that feeling of cold hands. It's a restriction of the vessels, the blood vessels in your fingers, so you might find yourself looking like the tips of your fingers are quite white, and you know that when it's cold like it is at the moment, you experience real pain. I don't know what your I'm not commenting about fibromyalgia, but I'm just saying that that's one of the many symptoms that I've experienced with my lupus. How can you give justice to this in 5 minutes? First of all, I would say thank you so much to Dr. Kenny, because really he's just explained everything for me, really. He's saved me the job of kind of going through with you all the different types of ways this manifests. And suffice to say that my journey, I think that I started to show the first symptoms. I don't know what caused it, but I remember when the journey started. It was 1995.
So Elizabeth, can I just ask, because one of the things he said, I like the analogy of the elephant, where everybody keeps going to all these different
That's what I'm about to tell you.
Yeah, so between when you had your first symptom and when you finally got your diagnosis, how long was that?
So 7 years.
7 years.
Wow.
7 years.
7 years. And a lot of that, and I'm just going to be out there and say it, was to do with racism in the system. It's absolute systemic racism. And I'm sorry, I just have to say it like that, because there wasn't anybody who was prepared. All those things went into it. People's preformed ideas. Obviously, I didn't see anyone from my race, not obviously, but I didn't. I saw my GP, who was Jewish, who at one point when I was going to him with my advancing joint pain that I was having, when I couldn't grip the wheel of my car, he was saying to me, and I had these skin complaints, so there was nothing I could do. It's like I suddenly became allergic to everything. It became advanced. I sort of have to a little bit start at the beginning, though I will limit it. I do a little bit need to start at the beginning. We had a very, very hot summer I think it was 1995.
Yeah, 95 was a hot summer, I remember, because my daughter was born that year, and it was unbearable.
Boiling, wasn't it?
It was boiling.
So I started to come out in all kinds of rashes, and I just started getting rashes that I couldn't get rid of. I used all kinds of creams. It didn't seem to work. And everything I used seemed to make it worse. I felt like my skin was on fire. And in fact, it got to the point where I was literally stripping off the skin off my face. It was coming off that rapidly. I look at pictures now, and there was just patches of bright redness, like all the top of my skin. It's like I'd used a really bad skin bleach. I don't know if you've ever seen anybody who's kind of using skin bleaching, but sometimes you see it in their face. I always recognize it from when I went through that. So it was all under my eyes. It stung. Everything stung, so I would always be putting water on my face just to try and calm down the fire that I felt in my skin. But the more that I put the water, the more it hurt me. I went through every single type of moisturizer. I couldn't moisturize myself properly, and that we're slaves to the moisturizing. But it's just like everything made me worse. and they couldn't get on top of it. I was always ending up in A&E. I was going to the doctors on a regular basis. It just was a whole series of things. In the end, I started getting, because I'd be washing my hair, trying to, because also my shampoo would sting, everything was painful, and it started to get scabs. And underneath there was like almost like a liquid. So I could tap my hand like this and it would just be wet with this liquid. The doctor at one point said to me, do I know witchcraft? Because, you know, he can't explain what's wrong with me. Has somebody put some kind of a spell on me? And then that's a God's honest from a GP who's many years experience. That is what I was told. So this is the kind of thing.
This is just hearing you say this, it sort of complements everything we've been hearing from Dr. Kenny. And you know, sometimes you hear these, and we have Black doctors here every week in, week out. We've heard how so many different conditions impact Black people to such a degree that people don't believe them. Endometriosis, now we've got lupus. And I think it's really useful.
Oh, yeah. When they saw the thing.
Black doctors, and if you'd met a Black doctor who was, if you'd met Dr. Kenny, when your symptoms first started, it wouldn't have been 7 years, is all I can say.
No.
So what I'm going to do now, if you just want to wrap up, because there's so many questions that I'm receiving, and I think that people are just saying thank you for bringing your story. So thank you so much.
Thank you, Elizabeth.
Well, just to say, I'll pick up on that last one. Water is the worst thing that you can do. Just plaster yourself. Emulsifying ointment is my key ingredient. That is what I plaster myself with morning, noon and night. That protects me. And at times they actually put me into the infectious diseases ward because they thought that I had some kind of catching disease on my skin. So this is where I say that it's a little bit of racism played into it. So I'll be quiet now.
Well, I think that the infectious diseases reminds me of the elephant story as well, because it's the same thing. Every single specialist just sees a little bit. But thank you so much, Elizabeth. That was just, it's such a compliment to have someone who will come out. And there are people here who will be thinking, I had that. And just hearing it from you as our
thank you, Elizabeth.
Patient specialist is great. Thank you so much.
Thank you, Elizabeth. My fellow expert. Thank you.
So I think I'm going to start with one of the first questions, Dr. Kenny. One of the questions is that someone's saying, thank you so much for the session. They're saying with all the research that's going on, why is doesn't seem to be any progress with what's happening with lupus? I'm sure there are people here who have the same story about the length of time between their first symptoms and when they finally got diagnosed.
Yeah, I mean, that's an excellent question. Just to formally thank Elizabeth again for having the courage and just coming forward. It's amazing. Yes, sadly, it's the ignorance is really based on just clinicians not being aware of the condition. It hasn't changed because lupus, in fairness to people out there and to doctors, GPs, some other specialists, because lupus doesn't present in a predetermined way, people can get caught out. So what I would advise is you as the patient, if you have unusual symptoms that are unexplained, you need to see your GP. And remember that there's access to lots of platforms now. You can see a GP privately, you can see a private specialist. Just make sure you get yourself heard, get yourself seen, so that we can get to the bottom of this. And the other thing I'd like to mention is research. We as Blacks, we don't contribute to research as we ought to. So a lot of the data we have, sadly, are from non-Blacks. It's mainly Caucasian data. So if you are contributing to research, then we can at least know what the disease is like for us, for Blacks, for non-Caucasians. Very important. But sadly, the ignorance is getting better. It's not so bad, but you, the patient, has a big part to play.
I think that's so telling, and especially when you said today's medicines was yesterday's research.
Absolutely.
And if we do not contribute, then we cannot advance the science. And I think that the people who do tend to understand this are people who have had the condition and are benefiting from those years of past research. But for those of you that are on the call who have come here because you've got friends or relatives who have lupus and want to know a bit more about it, please encourage people to enter trials so that we can advance this condition, especially because it has such a affliction for Black women.
Sure, sure. I was going to mention very quickly as well that remember that when your doctor says research, you have to remember before a drug gets to the stage where you're invited, it has been rigorously tested. Because I approve research studies, and before I'm doing the approval, it's already had animal testing, all sorts of testing. So it's already been tried in people already. So you're not being used as a guinea pig. What we're trying to determine is, does it work in real world or it doesn't? That's what we're trying to determine. So don't look at yourself as a guinea pig. It's actually an opportunity to make a difference.
So the question here about menopause, I suppose because it affects women, there are questions around the fertility and menopause. And there's a question here about the pain from fibromyalgia has reduced considerably, now coming to the end of this stage of menopause. Is there an effect of menopause on the condition?
Again, now, because hormone changes can make a difference, some people might find reprieve when they hit menopause, that their symptoms of fibromyalgia might get better. Some people, it might actually be the reverse, they might worsen. So I think for the person that has experienced some benefits since starting menopause, I would say the benefits you've had are actually as a result of other things you've been doing right. So you're now sort of getting the rewards of the other good behaviors you've adapted, not just the fact that you've gone into menopause that's helped your fibromyalgia. So it's a whole package that helps fibromyalgia, a whole package. So it's not a one size fits all. So the diet has a part to play, eating healthy, fruits and veg, 5 a day, exercise, the right mindset, making sure you divide your work into little chunks that you're able to manage. It all plays a part. So while menopause helps some people, it has the reverse effect in others. That's what I would say.
There's also comment about the fatigue, and the fatigue being sort of out of keeping with what you'd expect, that they just feel really, really tired. Is fatigue a particular problem with these conditions?
Yes, it is. Fatigue is a big part of lupus and fibromyalgia, more so fibromyalgia. Now, what I always advise with fatigue is there's something I call a traffic light system, and I try to teach this to my patients. So I'll tell it to the group just to help you. So a traffic light system means on a green day is a day where you feel absolutely fine. Be yourself on a green day. Go to the shops, do your shopping, do your housework, do your work, nothing to worry about on a green day. Now, a red day is a day where you're really struggling, but I don't want you to sleep in bed all day doing nothing on a red day. It just means I want you to delegate more. So a red day is when you delegate more. Get someone to do the task for you. If there's something you need to do over an hour, do it over 2 or 3 hours. That's okay. Don't judge yourself. It's a red day. Then an amber day is in between. So you might just need to find a balance between delegating and doing the tasks yourself. So traffic light system, remember it works. And don't criticize yourself. People with fibromyalgia are often judged by others because they can't say anything physically wrong, but don't let them set the pace of how you determine your own day. But it's all about taking ownership. And the sooner you do, the rewards are there. Excellent question.
Okay, so the fatigue is real. So it's just finding a way that you manage it and not trying to ignore it, really. Yeah, thank you for that.
Sure.
There are lots of comments that have come to me and also in the public chat about the length of time between initial symptoms and diagnosis. I just want to thank you all for bringing your stories and your comments here, so that I think it gives support and hope to people who are perhaps listening in that have some of these symptoms, and it provides them with some background of which they can take to their doctors.
Sure.
The other thing is, if there are people here that have a couple of symptoms that keep going backwards and forwards, what sorts of things are definitive? Are there any things? I know you've told the story of the elephant, but are there things that are sort of almost, you think to yourself, if you see somebody with one or two of these symptoms, that they say to you, this is almost likely to be this condition.
Yeah, excellent question, Ngozi. And what I find actually helps is that, and this is something for everyone to learn from, we're in the era of the use of smartphones. Help your GP out. If you notice a rash on your hands or anywhere, get someone to take a photo in good light. Document events. Take a photo of your swollen joints. I can never overemphasize when I've seen a patient on the day and she has no symptoms, but she's taking photos of swollen joints, a rash. And I look at those photos and I say, yeah, this is lupus. You're absolutely spot on. Nothing to see today, but this is lupus. Then we do the blood test to just guide how aggressive it will be. So take a photo, help your GP out. And nothing is wrong with you going to your GP and telling your GP, do you know what? I've done my research. I think this is lupus. Your GP is unlikely to push you away if you guide him to say, do you know what? I've done my own research based on joint swelling, hair loss, and this. I think this may be lupus. I think this may be fibromyalgia. I think this may be another diagnosis. GPs are actually willing and happy to guide you along the right path. I'll be very hard struck to think a GP will not listen to your thoughts when you've guided him on the diagnosis. Remember, GPs are human. They're not meant to know every single diagnosis under the world, but they're meant to guide you. Remember, doctors are the guide at the side, not the sage on the stage. So we can't know everything. So we need your guidance as well. So guide your GP, document, take photos, and show to your specialist. And that's a part.
Thank you. I like that. I think I'll use that again. Guide on the side, not the sage on the stage.
Not the stage on the stage.
Absolutely. And this is a partnership. And I think for all the things that we have managed to achieve with these health hours, it's the fact that I think it empowers people to actually truly have a proper partnership with their GP. So that if they've been doing their blood pressure on a regular basis and it's higher than usual, and they go to their GP, it's not high on the day, they can actually provide some support for their GP to make the right diagnosis. They are guides, and that's why this is a real partnership of yourself and the GP. And now some doctors will see themselves as sages on the stage, and you know the ones I'm talking about, Dr. Kenny.
Yes, I know.
I've come across them.
But that's never the right way to go. Remember,
never the right way to go.
Your doctor is just your guide. We're just there to guide you in your decision path. I always tell my students in the medical school that no one was born a consultant. So I don't expect that your doctor should rule the roost with you. They're not meant to be on your journey of your health. I don't tell you what to do in the negative sense.
I don't know if it's just me, Dr. Kenny, but your sound cut out a little bit and you froze for a second. So it might be your internet. Nadine's put on the chat about a heel prick. There's hoping to find out from a foot prick when babies are born, those who may be predisposed to lupus. And that, I think she's talking about the plan to have a screening program from a whole genome sequencing. So currently there are 9 conditions that you do for a heel prick, where they screen conditions that can help you have a sort of a head start in treatment. And as you may know, sickle cell is one of those screening conditions. So the plan is that they're doing some background planning to look to see if they can increase the number of conditions so that you can sort of, first of all, early identification. And if they early identify, you can have early intervention.
Sure.
It's quite a difficult area because there are up to about 200 conditions that you can identify at birth. And the difficulty is identifying which ones will provide you with a platform for intervention. Because if you can't intervene, then there's a discussion about, is it really useful and helpful to provide a diagnosis for a condition that you can't do anything about? So it has some ethical issues, but I think this is one of them because of the length of time it takes to diagnose a condition, that if we can identify who's susceptible at birth, then that would be a good one to put on the platform. So I'm involved in that that discussion. So when I saw the heel prick, I thought I'd just say something about it.
Sure. Thanks for the thoughts.
There's someone here that says that there's a support group. So if you are, could you put your details in the chat? Josephine, thank you for letting us know that there's a support group that's run on a regular basis. And if you can just, the CAHN team, if you can take those details. So for people who are here who'd like to know a bit more details about that, because it seems it can be such an overwhelming condition. To have people around that can support each other would seem like a really good thing to do as well. Do you know of any sort of patient groups that provide support, and specifically for Black women? Because one of the things I find, I know that we have lots of premature baby support groups, and I think it's a bit more accessible now that it's online, but previously they were not very diverse. So even when I'd had patients where parents had sent them to these support groups, they'd come back and they'd say, I don't think I really fit in, and didn't then join in. So I think when you can have groups where it's a lot more diverse, that it helps the engagement, and it also helps with encouraging people to step forward for research. So are you aware in your role of any sort of help groups and support groups for women in this condition?
Yeah, so there's a lot of wonderful literature and materials from Lupus, the organization, Lupus itself, Lupus UK, and also Versus Arthritis. There's wonderful resource out there. But what I would also say is that you as the patient, someone like Elizabeth, our in-house resident expert, you can actually set up your own group, set up your own forum there that know what they're struggling with and how to help others. That will be encouraged. Information's out there. You can set up your own group and use your healthcare professional as your guide to refresh your knowledge, and just always attend the expert patient forums and discussions.
Thank you, Dr. Kenny. There's another question here about alternative remedies. And I'm sure people ask you this, especially if it's a chronic condition. So are there any treatments that you know about? So alternative treatments, holistic health, foods to avoid that might bring flare-ups, anything apart from just straightforward medicine?
Yeah, sure. I mean, to be honest, I don't have any issues with complementary medicine. What I would say, and this is buyer beware, caveat emptor, it doesn't help everyone. So I don't want, now if you go on YouTube or any of those videos that circulate on WhatsApp where someone is telling you every drug for lupus is poison, try this herbal medicine that works, that's nonsense. That's flat out nonsense. There's a role for supplements, but it's meant to be used as an add-on for your therapy. And make sure if you are using the supplement, you need to tell your specialist about it. I, for one, like my patients to tell me everything they're using, because some of these supplements contain ingredients that can affect the way the drugs work. So I have no issues with supplements. I have patients that take turmeric supplements. There's a drink called kefir. It's an Eastern European grain that can be turned into a milk. That's good for joints. I have no issues with that. Vitamin D supplementation, that's fine. I encourage things like that. A bit of cod liver oil, nothing wrong with that. But do not leave out your own routine drugs at the detriment of chasing supplements. That's foolhardy. Don't do that. Remember that every drug that's been developed has been developed as a result of extensive research. And some of these drugs have come from plant products. So don't snicker at drugs. Use it in conjunction with your supplements, please.
Thank you. That's really clear. Now, although the talks about lupus and fibromyalgia, they're slightly different, isn't it? Yeah, and although we're talking about them as one whole, I think they're different parts of a spectrum of disease. Yeah. And one of the questions here is, why is lupus so much more prominent in the Black population? And is it the same for fibromyalgia? Do you see the same ethnic propensity for fibromyalgia as you do for lupus?
I think fibromyalgia is more balanced. It can affect any race, even men. Men can be affected with fibromyalgia, even as much as women. Remember the examples I gave, JFK, he had fibromyalgia. Morgan Freeman, believe it or not, our Morgan Freeman is still living with it. And I think probably Nick Cannon has a bit of fibromyalgia as well. But people don't like to necessarily tell you the in-depth bits they struggle with. But it's a real diagnosis. I think somebody on the chat is asking about, is fibromyalgia life-limiting? It's not life-limiting, but it can suck out the enjoyment of your life. The thing is to take ownership and do what you can. But lupus can be life-limiting. So do take your medication, take your vaccines, and eat healthy, and just have the right mindset. There's a trainer of mine that would say every one of us will deal with disease. It's a question of when it happens, not if it happens. So I don't want you to look at it as a death sentence. Just roll with it. Do what you can. And yes, someone's mentioned that Seal has lupus. Yes, absolutely. Seal is a prominent example, and he's left scarring on his face. So please bear in mind, just roll with it. Do what you can. Get the support. Little as often as much as you can. And once your when comes, just roll with it and do the best.
Thank you. Are there any reasons why lupus affects Black people more? Is any research or any explanation why this is?
Yeah, I think it has to do with our wonderful pigment called melanin. I think melanin has a wonderful part to play in it. I mean, there's still a lot of genetic studies. Sadly, a lot of us Blacks don't enroll in research, so we're still trying to find out a bit more. But melanin probably has a bit to play. We don't know yet, but the more people we have helping out to research, the more those answers will come. At the moment, we don't quite know. So I would definitely encourage more research, but it looks as though melanin has a huge part. We know sunlight has a strong link, and obviously, being from the tropics, yes, you can establish that link very strongly. But research, just participate in research, help us out. Let's get these answers, and let's try and control this dreaded disease better.
So one of the things I would say is that from the research, I guess that when people come to your clinic once they've been diagnosed, that's a captive audience. And one of the things I've found over the last few months and years after having been involved in the Caribbean African Health Network is that very often people don't know where to go to seek them out. So, for example, you're involved in research now, and if you ran a trial and you found that it wasn't balanced in terms of who was coming forward, what would you do? You would contact us, because we have a captive audience. We know how to get and speak to people in our community, really. Because I think sometimes I do wonder the common assertion that we don't step forward. The fact is that if you find us and you ask, we will. I do wonder where they're advertising some of these calls for research. There was a few weeks ago, Faye and I were on a call, and they had set up a research study, and they were saying that they didn't have any, it was for Black pregnant women. And most Black women who are in childbearing age will know the statistics to do with poorer outcomes.
Sure. And
so this research study was saying, well, we can't find any Black women. Now, what we were able to establish is that they hadn't gone to the right places to find Black people. And once they contacted us, they were overwhelmed. So if there are any studies that you hear of that are having difficulties in recruiting a diverse population, then you can always direct them to CAHN, and we'll be happy to help.
Thank you so much. That's brilliant. And we need wonderful women like Elizabeth, the voices we need. Because people may think I, as the physician, have an agenda to just try and get studies published and the rest of it. Quite the contrary. I'm a different kind of physician in that my patients, I take them personal, and I tend to know a lot of them. I've known them for years, and they refer to me on a first name basis, and that's absolutely fine. CAHN, you're doing an absolutely amazing work. I cannot underestimate that. That's well done to you guys. And Elizabeth, keep the flag flying, speak out, help us out. We need expert patients, the more the better.
Thank you so much. So thank you very much, Elizabeth, and thank you so much, Dr. Kenny. This has been, as usual, a really, really good session. And I'm going to hand over to the CAHN team to tell us what's happening the next week. But I listen to these and I always come away enriched. I feel empowered, and I hope for those of you that have listened today, you feel the same thing. So thank you so much. Charles, Faye, Elizabeth from Caribbean African Health Network, if you want to just update us about what's happening in the next week. Thank you. Charles, I can see you put in the chat that it's flu and asthma, and I presume from that you'd like me to update then. Okay, so what I will say is that you can check our website. Please join our mailing list to get an update of what's happening so that you don't miss out. Next Saturday, we have another Black expert that will be coming to talk to us about flu and asthma. And because we're entering the winter season, you might want to be here to find out a bit more about the flu vaccine. I know people have been worried about the fact that we're having boosters for COVID. We need to have our flu vaccine and keep ourselves protected. So come along and listen to another of our Black experts, because if you have any questions, they'll be able to help you to answer them. So please go onto the CAHN website, register for our weekly mail shots and join in all our activities. And I'll see you next week. Thank you.
Just want to say thank you very much. Thanks for allowing me to speak and for an excellent session. Thank you.
Oh, it wasn't really allowing you. The session was made richer by your.
Yes, it was. Thank you.
Well, you've inspired me to set up a group now. It's like, wow, why have I never thought of that? So I don't know what it's going to look like, but watch this space.
Well
Your
done,
enthusiasm
well done.
will pull it through, Lisbeth. Thank you. Okay, have a nice weekend, everybody.
Thank you. Thanks, everyone.
Bye.
Thank you.
CAHN Health Hour. Giving Black health advice. Get informed today to have a better, healthy tomorrow.